Nurses are placed in many positions where there is potential for back injury. How many of us have walked into a patient's room and seen someone on the floor? We have to suppress our first instinct to help the patient up and get help. Back injuries can be detrimental to a nurse's career. In 2017, nurses lobbied to make New York a zero-lift state, which means we shouldn't be manually lifting patients and have mechanical assistive devices available to us. Nurses should be using lift equipment like hover mats and jacks and Hoyer lifts to promote safe patient handling and prevent musculoskeletal injuries. According to the U.S. Department of Labor, each year there are more than 35,000 nurses that suffer from work-related back injuries severe enough to cause missed work and disability. Using equipment like these hover jacks and mats can save nurses' backs and careers. A 2015 report from the Department of Veteran Affairs showed that nurse-related injuries dropped 80% since implementing the use of lifting and moving devices. Using equipment like this sit-to-stand assist allows patients to participate in their care while preventing back strain on the nurse. Lifting patients the wrong way can cause harm to nurses and patients. Reports have shown that training and orientation programs alone aren't enough to prevent back injuries. Patients should participate in their own care as much as possible. This is a demonstration on the proper way to boost a patient in bed. Nurses are at the highest risk for back injuries that lead to chronic conditions, especially low back pain. Hospitals and nursing homes are the highest risk careers for nurses. The leading recommendations are to have at least 2 nurses in all lifting situations. Reports show that each nurse should not be responsible for more than 50 kilograms of weight each. So a patient that is 100 pounds should technically have 4 nurses to lift them. Nursing is a hard job, being compared to one of those of the hardest labor, and by addressing back safety, nurses can be employed longer and have a more satisfying career.